Clinical trials are important because it's a way for us to determine if a new therapy is safe and effective. When we think about clinical trials, we often think about new medications, but it may be that it's a medication that's currently available in which we're trying to see if it's effective for a new indication or a new disease state. Clinical trials are also ways of seeing if a surgical procedure or a medical device is effective and safe. But it may be something as simple as an intervention such as weight reduction, exercise, diet, or cessation of smoking, that we're trying to see whether these interventions are effective in preventing or lessening diseases. Clinical trials are very carefully controlled experiments. It's a way of taking theoretical effectiveness from the bench to the bedside. We need to see whether in particular diseases a new therapy is effective, and we do that by checking on the patient regularly, but also we need to know that it's safe to give the therapy to the patient because we don't want to compromise healthcare. So clinical trials are a way of checking that a therapy is both effective and safe. Not only are clinical trials means of establishing if a new treatment is effective, but it may be for determining if a screening test works, whether a diagnostic procedure works, or whether there is a new way to treat a condition. Some clinical trials now actually compare therapies to see which is more effective, as well as monitoring which is safest. Clinical trials provide the evidence base upon which we manage patients. It is a way of maintaining the quality use of medicines, as well as best practice when it comes to looking after patients and their health. It's important that people are aware of clinical trials because it may be the only opportunity they have to receive a treatment. There are some conditions where the available treatment is either relatively ineffective or there is no treatment option. So a clinical trial may be the only way to treat their disease. Clinical trials are also a way of preparing medical care for the next generation. I have one patient, he's well into his 70s, having his psoriasis treated. He doesn't really mind if his disease gets better, but he wants to know that there's a therapy available for his grandchildren should they develop psoriasis in the future. It may be that for some patients, a clinical trial is an opportunity to trial a new therapy because they've exhausted all the currently available treatments. Clinical trials are also a way for members of the public to become engaged in medical research. Almost all trials being developed now have consumer advocacy groups involved, so the patients themselves are represented when the trials are being designed. It's not just about laboratory-based scientists or medical practitioners deciding what's the most appropriate way of testing a new therapy. It's important for everyone to remember that clinical trials are voluntary, so they're not forced upon anyone. Patients need to volunteer and they can withdraw from a trial at any time. So it's a way really to, one, you may have a treatment that is otherwise not available, but two, you help provide the best available healthcare for future generations. Clinical trials have made available new therapies for patients that otherwise did not have any treatment options available. If nothing else, clinical trials have made medicines available that improve quality of life. For example, in psoriasis, an area in which I am particularly interested, the best way of managing very severe disease was inpatient care, 3 weeks in hospital, confined to bed. With the new treatments we have, we can keep people out of hospital. People can be managed at home, in the community, they can go about their daily work or study, whatever they're doing. It's not interfering with their life. So we see improvement in signs, we see improvement in symptoms, we see improvement in quality of life. People with severe uncontrolled health conditions often have concomitant mental health issues, increased rates of anxiety and depression. If you bring their condition under control, patients relax more. They're not worried, they're not depressed, they don't have the stigma associated with their disease that's impacting on their quality of life. So they can just go about living life. And really the only reminder they have a condition may be the requirement to take treatment at whatever interval it's required to take the treatment. In psoriasis, going back to a condition that I like to treat, in addition to the skin condition, there are a number of comorbidities or other disease states that occur more frequently in people with the original disease. What's been shown is that in some patients, if you improve one condition, as a knock-on effect, those secondary conditions will also improve. So it may be that long-term effective therapy of psoriasis reduces the risk of cardiovascular disease. So you reduce heart disease as well as treating patients for their skin condition and improving their quality of life. What we have seen is that by having clinical trials, we've improved the quality of life, but also the morbidity and mortality associated with many disease states. Clinical trials have meant that healthcare has improved because we now have new therapies that are both safer than what was previously available and more effective. So we can improve patients' quality of life by improving their medical condition.